Now, of this particular beta blockers, you take the selective beta 1 blockers. You take the selective beta 1 blockers. If you take the selective beta 1 blockers, they include nebivolol, they include metoprolol, esmolol, atenolol, acebutolol, bitoxolol, bisoprolol, and as well as celiprolol. These are the selective beta 1 blockers. But the problem with the beta blockers is, these beta blockers, they will cause bradycardia, that is, they will cause decrease in the heart rate of the individual, right? They will cause decrease in the heart rate of the individual in some patients, and in such patients what we have to do is, we have to use that particular drugs that will possess a partial agonistic activity. Alright, so as such, these beta blockers, they will cause very severe bradycardia. So in those group of patients, what we have to do is, we should use the beta 1 blockers which are having partial agonistic activity. Right, partial agonistic activity, they are preferred. Now, what are those drugs? So those drugs which have beta 1 blockade and along with partial agonistic activity, those include celiprolol, oxprinolol, pindolol, alpranolol, and as well as acebutolol. These are beta blockers with intrinsic sympathomimetic activity. They will not cause bradycardia. But remember, all beta blockers, they can lead to rebound hypertension on sudden withdrawal after the prolonged use, right? The problem is rebound hypertension on sudden withdrawal after the prolonged use. So this is about your beta blockers. Next, we have another group of drugs which will block alpha receptors and as well as beta receptors, and they include combined alpha and beta blockers, right? They include combined alpha and as well as beta blockers. So the drugs under your combined alpha and beta blockers include, one is labetalol, right? One is labetalol and the other one is carvedilol, right? The other one is carvedilol. So remember, your labetalol and as well as carvedilol, they have antagonistic activity of both alpha and as well as beta adrenergic receptors. And where are they used? They are mainly used in control of hypertension in pheochromocytoma. In pheochromocytoma. Now remember, pheochromocytoma, it's a tumor which is originating from adrenal medulla, which will release excess amount of epinephrine and norepinephrine. In that clinical scenario, we use this particular combined alpha and beta blocker, mainly labetalol. Whereas you take this particular carvedilol. This carvedilol, it is having antioxidant and as well as anti-mitogenic property. It is having antioxidant and anti-mitogenic property. Now, because of this antioxidant and anti-mitogenic property, these are used, or this is used in patients with the congestive heart failure. Remember this point, carvedilol, it has antioxidant and anti-mitogenic property, and that is the reason why this is useful in the congestive heart failure. So this is about your alpha blockers, beta blockers and alpha and beta blockers. So remember, overall these are the group of drugs which will cause sympathoplegia. right? So what we have discussed in the beginning, sympathetic nervous system stimulation, it plays an important role in the regulation of the blood pressure of the individual. So if sympathetic nervous system is excessively stimulated, there is excess increase in the blood pressure. Now you have to reduce the activity of the sympathetic nervous system in patients with hypertension. Now in what all ways you can do sympathoplegia? Number one, you have to decrease the central sympathetic outflow. Number two, you should block the autonomic ganglia. Number three, you block the release of adrenergic neurotransmitters. Number four, you block the receptors of the adrenergic nervous system. In these four ways, we can achieve sympathoplegia, and thereby the blood pressure of the individual can be reduced.